are priority questions, right? So these are going to be your who do you see first? What should the nurse do first? What do you do next? What's the nurse's initial response? Things like this. And then when it comes to delegation, who would who would be in charge to get who would be appropriate to delegate this type of patient to, that type of stuff. And one of the biggest things to make it very simple when it comes to priority questions, aside from understanding the content, is to focus on the nursing process. So if you could learn how to remember and recall the entire nursing process and then implement it whenever you are getting these questions, you'll be more likely to pick better answers. So one of the biggest things I noticed for a lot of test takers that are struggling to pass their exam is that they always assume that the question is always in the assessment phase, right? So as long as it says, like for example, if there's an answer that says get the vitals, they'll pick that one immediately because it's an assessment and it's the very first step of the process. But however, though, if the question shows that the nurse has already gone through the assessment, the diagnosis, the planning, then therefore the next appropriate step would be the implementation phase. So the answer that you're looking for should be in alignment with implementation, not assessment again, right? So that's one of the biggest things that I've seen is that not paying attention to, not recognizing, okay, which part of the nursing process are we in based on the question, and then from there picking the answer that matches the next corresponding step of that process, right? So assessment, the first process is assessment, where the nurse uses a systematic dynamic way to collect and analyze data, and that's the very first step. Then we have diagnosis, which is where you use your own clinical judgment to diagnose what's likely going on with the patient, right? This could reflect the patient's not only just pain, but what are the problems that's contributing to their issues. Planning, right? Planning, like I said, is like, okay, now that we know the assessment, the diagnosis, what are we going to be planning to do, right? That would fall in line when we think about nursing diagnoses, and we have to identify what are the short-term and the long-term goals. And then implementation now is now where you're talking all about what do we do, right? So what are the appropriate interventions according to the care plan for the patient that is being represented in the question, right? So that's what this is all about. And then finally, evaluation. So that's going to be where now we evaluate the effectiveness of the nursing care and modify the care as needed, right? So when it comes to priority questions, really big thing, you need to identify what point are they in the nursing process based on the scenario and then pick the appropriate answer, right? So that will honestly help you a lot to identify the best answer versus always assuming as something that's assessment. Okay, let's go through some questions. A Hindu patient arrives after a long, drawn out battle with pancreatic cancer. The family is gathered by the bedside. Which of the following interventions, if offered by the nurse, would be most appropriate? Now, this type of question is not related to really priority, who do you see first, but more so about culture, right? So culture competency is also part of this category as well. So is it going to be one, ask the family if they would like a priest in the room? Two, turn the patient's bed so that his head faces east. Three, bring a crisp white sheet to the room. Or four, bring water and a basin. All right. So for this one, the best answer is going to be two. Turning the patient face to east is a proper death ritual in the Hindu religion. All right, so that's the best answer. This one is not really so much critical thinking, but you just have to be aware of the culture implications for, in this case, the Hindu religion. So when it comes to nursing care, we have to be aware of things like cultural practices as it relates to medicine. Next question says, a nurse is working in an emergency department and receives a client after a radiological incident. Which task is utmost priority for the nurse to do first? A, decontaminate the client's clothing. B, decontaminate the open wound on the client's thigh. C, decontaminate the examination room the client is placed in. Or D, save the client's vomitus for analysis by the radiation safety staff. Now, if you want to, you can absolutely stop the video right now and comment below what you think the answer is. So anytime you're going through questions, the way that you truly know that you're answering the questions best is that you're able to immediately recall the relevant content in order to pick the best answer, right? So if it's where you're like, you see the question and then you immediately are thinking like you're trying to pretty much pick an answer, you're trying to guess at random, then and you're doing that consistently, then you may have a problem with content knowledge, meaning that you need to know more content, period, in order for you to do better with the questions. So for example, with this, immediately, if I see a question that talks about radiological incident and what's the priority, you should be thinking about, okay, what are the appropriate nursing interventions for radiation? And so shielding and distancing is the biggest principles that you learn when it comes to radiation exposure. So now it says, what do we do first, right? So we have to think about which is going to be the most concerning in order to reduce or immediately limit as much radiation exposure as fast as possible. Is it going to be their clothing? Is it going to be the wound on their thigh? Or is it going to be put them into another room or save what they vomited to analyze later? So in this question, the nurse should actually do all the tasks, but it wants to see if you identify the first thing. So you should think about the physiological impact of exposure to the radiation. The open wound is the most direct and open and immediate source to the radiation, right? Because even if you do the other things first, like for example, if you decontaminate the clothing and they still have that wound site, you're not really limiting the exposure because the wound is still infected, right? Or infected is the wrong word, but the wound is still exposed. So the most appropriate thing and the thing that requires the fastest intervention is definitely the wound, because that has the closest proximity to the patient because it's a part of their body, right? So the wound is going to be the best answer to choose. All right, which was A. That's right, B. All right. So did you get that correct? Let me know right now in the comments if you got that answer correct. Okay. So let me see. Okay, so if you need help with when it comes to the type of material, make sure you let us know below in the comments. I also do have, we just launched our 30 days NCLEX Bootcamp. 30 days NCLEX Bootcamp. This is a great opportunity for those of you that are either first-time test takers or repeat test takers, and you want to be able to pass your exam within the next 30 days, and you're looking for the right information, the guidance, and the motivation you need to succeed. This is your answer. Go ahead and check the link in the description below this video to learn more about our 30 days NCLEX Bootcamp. Thank you